Good evening, everyone. Happy February. My name is Brandon Smith. I'm chair of the Community Board 2 Health, Environment, Social Services Committee. I'm honored to welcome you to the February meeting of our committee and introduce you to the committee members and our wonderful setup. First, I got to read some opening announcements that we have about meeting protocol, so just pay attention to these really quick. First of all, this meeting's being recorded for public access and archiving in accordance with the state open meetings law. It's a practice of Community Board 2 to conduct remote meetings with all committee member cameras on. Public attendees are also encouraged to leave their cameras on, particularly if you're given the floor to speak. All attendees, please keep your microphone muted if you're not speaking. To maintain an appropriate discussion and voting process, I will make it known when and which topics are open for comment by committee members, board members at large, and the general public. If there are any questions that fall outside of public comment time, please type your questions in the chat. We'll address them as time permits. You may also email the district office at any time outside of the meetings. We are committed to providing access for all of our neighbors, regardless of physical ability or limitation. If anyone requires assistance for full participation, they can contact the district office 72 hours before any public meeting. We also ask that everyone speaking or presenting use plain language, speak at a moderate tone, and frequently ask if you're speaking loud enough. If presenting, read the title of every slide and describe any images on the slide, such as photos, graphs, and charts. Finally, I want to emphasize it's the process and the practice of our committee. Treat everybody who's here with respect. And we generally expect that of everybody in attendance at the meetings. It doesn't matter whether you're a committee member, a board member, member of the public, a liquor license applicant, a social services provider, a staff member, or whomever. Anyone who's being disrespectful will be removed from the meeting, and we have no tolerance for that. I'm now going to have each of the committee members introduce themselves. First, I'd like to start with my co-chair, Ms. McKnight.
Recording in progress. Good evening, everyone. I'm Nicole McKnight. As Brandon mentioned, I'm the vice chair, and I am also a member of the community board.
Thank you. Ms. Thurston, do you want to introduce yourself?
Sure. Hi, I'm Jessica Thurston. I'm the secretary of this committee and of the full community board too.
Great. Mr. Ryan, would you like to introduce yourself? Oh, you're on mute, Mr. Ryan. Got to unmute yourself.
Good evening. My name is Jeffrey Ryan. Okay, I'm getting some feedback.
Brandon, if you mute yours while he's talking, it'll take that away.
Mr. Ryan, it's an honor to have you here tonight. I'll try to mute myself when you continue to speak. With that, Ms. Anadu, do you want to introduce yourself?
I would like dramatic entry music, but that's fine. Emily Anadu, member of Community Board 2 and a member of the HESS committee.
Thank you. Ms. Cumberbatch.
Good evening. My name is Monique Cumberbatch. I'm a member of the HESS committee and a member of the Community Board 2.
Thank you, Mr. Varela.
Hello, Alejandro Varela here. I will be participating in this meeting from a very loud and busy place, so I'll probably be on mute for most of it.
Great. Nice to see you and great to have you here as always. Did I miss anybody from the committee? I don't think so. Ms. Muller, did you want to briefly introduce yourself?
Oh, hello. This is Taya from the district office. Nice to meet the Unincarcerate America folks. We've been chatting, email, welcome.
Great to have you. Awesome. Well, we're in good shape and we shouldn't have such a long meeting tonight, but we've got to get started with our process. And the first step is an adoption of the agenda. Does anyone want to make a motion to approve tonight's agenda?
Motion to approve.
Motion from Ms. Thurston. I second the motion. Does anybody disapprove or abstain from approving tonight's agenda? Please say so now. All right, we're going to consider tonight's agenda approved. Next up on our agenda for the evening is the adoption of the minutes of January 2023. Does anybody want to make a motion regarding the minutes from January 2023? Motion from Ms. Cumberbatch. Is there a second?
I second it. It's Nicole.
Ms. McKnight with the second. Any edits, corrections, please let the secretary know. With this in mind, if there's anybody who disapproves or abstains from approving the January 2023 minutes, please say so now so that we can make note of that. All right, I will consider the minutes approved from January 2023. Next up on tonight's agenda, we've got the district level community health update. We are delighted to have our committee member, Ms. Nadu, provide us a monthly update on the status of the COVID-19 crisis as well as community health. Ms. Nadu, I will give you the floor to give your presentation. Thank you very much.
Thank you, Brandon. And thank you, Alejandro, for having on a mask to remind us that COVID is still here. Okay, getting into it. Oh, no, I don't want to share it. I mean, I do want to share it, but not like this. Okay, slideshow, sorry. So quick updates. I am so excited anytime I have a month where we are going in the sub 2-digit number for positivity. So just as a reminder, in January, we were at 16.7%. Kicking butt over here. We're down to 9.5% positivity. So things are definitely trending in the right direction. One thing that was also very cool, despite the fact that I might have, put some fear in people's brains about a potential spike over the holidays, we really didn't see it. So definitely there was a little bit of a spike, but unlike previous year, like last year in particular, we did not see a huge spike. So even here, this into December, into February, we are doing well in the state as of today. There was a question from community member Sid Meyer last time, and I just wanted to follow up on that specifically about the new variants. I think obviously we're all very aware when we heard of Delta and Omicron, but as we start getting into things that have names that sound like Star Wars vehicles, it's a little harder to keep track. And so the one that Sid asked about in particular was the XBB 1.5 variant. Yes, just rolls off the tongue. So the good news is that the bivalent booster does, despite this XBB variant being responsible for about half of new infections in the country, data released just as recently as January 22nd showed that basically the bivalent booster luckily does prevent, again, this new variant as well. And it looks like it cuts the risk of symptomatic infection by about half for most adults, and symptomatic speaks to you're getting at least one or two things like coughing, breathing issues, etc. So definitely it is a good thing to do. But unfortunately, this is the part of my presentation when I say, come on, guys. So in February, as of February 1st, we're at 14% of New Yorkers have received that bivalent booster. So that's only up from about 12.5% in January. Similarly, we only saw about a 2% lift with, one of the communities that's considered particularly vulnerable, and that is the over 65 population. But with that, still it is trending in the right direction. Positivity rates are going down, and most importantly, we missed that big spike. So I think overall that is it. We're trending in the right direction, but yes, get a booster. Yay, Alejandra, love that mask. And with that, I'm done. But please let me know if anyone has any questions.
Thank you, Ms. Nadu. It's really very impressive the extent to which your decks are reflective of community health updates, and I gotta say, it month over month they're just absolutely tremendous. You deserve a great degree of congratulations for that, even though it's not always as good as the news you're delivering tonight. Anyone have questions or comments from Ms. Sanadu? Either board members or members of the public? And I think it definitely is positive that we didn't have a huge spike that in January, but definitely would want to see the bivalent booster percentages increase over time. Hope people continue to take it seriously. Any questions from anyone for Ms. Anadu? All right. Well, thank you, Ms. Anadu. Really a wonderful presentation. Next up on tonight's agenda, we have open session for public comment on adopted agenda items. Now, I want to stress this point with respect to this item because I do this every month, but effectively, every time a presenter or an item of any kind comes up on our agenda, we ensure that there is time for public comment. It may be helpful to hear from the presenter first before the comment occurs, just so that you can get some feedback and background for your comment. But with that said, we do make this time affordable. If anyone has a comment they just can't hold in any longer with respect to our adopted agenda items, we have an adopted agenda item on Unincarcerate America presentation regarding their provider application submitted to the New York Office of Addiction Services and Support. So if there is any point to discuss about that, then this is the time for public comment. Any comments from the public at this time? All right. Not seeing any comments, so we'll move on to the next agenda item. Some of you may be able to guess what that was. The next agenda item will be a presentation by Unincarcerate America. We're delighted to have, do we have Pinel Dees and Maliki Cottrell here tonight, or do we have someone else?
You're muted.
Yes,
Hello,
we're here.
Oh, great, wonderful. So do you want to tell us a little bit about your organization? And if you can, feel free to present anything. I know that you were going to present some slides possibly.
Yeah, we wanted to present the slides and go through them.
Great. If you can do that, if you can just introduce yourselves first. And did you have a question?
No, I was going to say the presentation will give an overview of who we are, our mission, and what we plan to bring to your community.
Wonderful. Thanks.
So I'll start by saying my name is Malachi Cottrell. I'm one of the owners of UIA, which is short for Unincarcerate America. Unincarcerate America is a nonprofit whose mission is to lower the recidivism rate and the overall substance abuse rate. I'm here with another owner, the vice president.
Hello, everyone. Thank you for having us tonight. My name is Kinel. I'm the vice president. And like I said, we're going to get into the presentation. And is it okay if we share our screen now?
Sure.
Thank you.
Can you see our screen now?
Oh, not yet.
I think you have to hit the button to share screen.
Okay, 1 second.
There we go. We can see it now.
Okay, so can we start now?
Yes, go ahead.
Sorry about that.
We gotta go through that first.
Can you see us?
We can see the screen that you're trying to show, so you might not be able to see us while you're presenting. Oh, hi, I'm in the screen now, but yeah.
Okay, so UIA's focus is on education, rehabilitation, providing information and support to substance abusers, men and women who are incarcerated, formerly incarcerated, or on the verge of incarcerated, and lastly, everyday citizens who are lost and may need a little guidance. Our team consists of Justine Burden, our CEO. She's not here with us, but she has a master's degree in education and is currently a high school teacher at a charter school in Harlem. On a day-to-day basis, she teaches various subjects to students who have learning disabilities and suffer from mental health disorders, in addition to helping students prepare for college and cope with the challenges they face daily in their environment. Kenel D is the vice president. Can you hear her? Okay. Kenel D is the vice president, is a Buffalo State alumni who majored in psychology. She's a natural-born humanitarian. She has extensive experience working in corporate America at some of the most prestigious hedge funds and law firms in New York. On her days off, she has volunteered at nonprofits and assisted clients with resume writing, employment securement, school enrollment. And her passion came from her childhood. When she was a child, her father was sentenced to 25 years. And with her help, he was able to be released and fully rehabilitated. Today, he has been out of prison for 9 years and has not had any run-ins with the law or abused any substances. Rick Sae is our Chief Medical Officer. He has over 20 years of experience as a medical director and has an active New York State license. Dr. Sae also owns his own practice and has opened over 10 medical facilities throughout his career. He has extensive experience providing outpatient, acute, chronic medical care and wellness support. I, Malachi Cottrell, have extensive experience working with individuals who have substance use histories. I was formerly employed and was a representative of one of the largest outpatient facilities in New York City, which is the Fortune Society. I also own a small business and am a licensed real estate broker. I have over 10 years of experience running a business and over 5 years of experience being a broker and solving housing issues and working with low-income population. Beatrice Sumter, our director, has a degree in human services, behavior, mental health. She has over 15 years of experience managing and overseeing substance use services and addiction disorder treatment. Beatrice is certified to facilitate several outpatient courses, which include seeking safety, relapse prevention, cannabis youth 1 and 2, motivational interviewing, anger management, thinking for a change, codependence, knowledge of substance use disorder, professional and ethic responsibilities. And lastly, she has over 30 hours of office-approved trainings. Devin Neely, our secretary, has a master's of science in rehabilitation counseling. Devin has been working in the nonprofit outpatient field since 2016 and has experience working with youth, families, the formerly incarcerated, and she's worked with several OASAS approved facilities and has even assisted with incarceration and prevention. Jessica Sumter, our counselor, has a degree in criminal justice and has experience working in both inpatient and outpatient facilities. She's been working in this industry since 2015. Jessica has experience providing service to clients who are dual diagnosed with mental health and substance abuse disorders. Jessica develops treatment plans, does individual counseling and case management. Jessica is thoroughly educated on federal and HIPAA guidelines and regulations. Lastly, she has been employed by several OASAS approved nonprofits and thrived in every position. So now we're going to get into some questions and answers. So our business plan, the services that we plan to provide in Brooklyn Community District 2. So we plan to provide an array of services to the community. We will provide substance use treatment to help substance abusers, in addition to combating the opioid epidemic, which is at an all-time high. Coping skills and anger management services will be provided as well. We will provide assistance with school and vocational enrollment for community members who want to further their educations. Studies show that the more an area is educated, the less there will be crime in the area. We will also provide employment assistance to the unemployed by providing training on interviewing, resume writing, and partnering with companies who are looking to employ. We will also provide assistance with housing. Having a home or a place to stay is a key essential, so we will assist clients with getting housing vouchers, getting into a shelter, and getting an apartment or home to those who can't afford to pay for housing. We will also provide assistance with clients getting health insurance. We also plan to have classes on healthy eating, entrepreneurship, credit, and our financials will be provided on our website after we open up and we're in business for 12 months. So next, we will be registering with the Better Business Bureau and Charity Navigator. And our annual report will be on our website. So how do we go about vetting social workers? When UIA hires a social worker, we focus on their education, experience, passion, and cultural competence. We want a staff that is focused on our mission and can provide measurable results. How are our volunteers trained and supported? Our volunteers are trained by our onboarding staff, the staff who trains the paid staff. They will also have a company policy and procedure manual to refer to, in addition to attending mandatory training classes. What is UIA's history and connection with Brooklyn Community District 2? So UIA is comprised of New York City residents. All of the owners were born and raised in New York City. And after assessing New York City, we realized that Brooklyn has one of the highest rates of opioid use and the lowest amount of outpatient service providers. So in 2021, 2,668 people died from drug overdose in New York. So our goal is to bring that rate down and to lower the rate that people go to prison. So that's what our mission is, and that's why we're bringing these services to Brooklyn Community District 2. That's our whole PowerPoint, and if you have any questions or you want to check us out some more, you could go to our website, which is www.unincarcerateamerica.org. We're also on Instagram. So that's our presentation. And if you have any questions, we'll be more than welcome to answer.
Great. Thank you very much for your presentation. Very, very much appreciated.
Thank you.
Just a couple of things off the top of my head, and I'll definitely open it up for the committee. But first, just so we get a chance, and sorry if I missed this, but is there a physical location within the community district where you're going to be providing these services, like an office or a specific place? And perhaps if you could go into the level of experience that Unincarcerate America has with providing these services in other locations.
So, yes, so we are currently in talks with the landlord of 247 Water Street. So we're looking to be in that area. So, but we're waiting to get the certificate from first before we open up. And all of the members have different experience with providing these services. So like we said, our CEO, she has an education background. So we're providing different services. We're providing school enrollment, vocational enrollment, employment, assistance with employment, assistance with housing, substance abuse. So every member is bringing their experience and expertise. So Dr. Syed has been licensed for over 25 years, and he currently has a practice that does these services in Westchester. And yeah, so he has over 25 years experience with outpatient services. And yeah.
Great. So I guess just a couple of things. Is this kind of like the first time? I get it that everybody in the organization has some experience, but this is like the first engagement for Unincarcerate America as an organization to start offering these services?
Yes.
Yes.
Okay. And in regarding your proposal to get the letter, what is there any sort of like timing that you have around that, or when you're intending to submit this, or what the plan is in that regard?
So we would like to get the letter as soon as possible because we have an application that's pending right now. We already submitted every document and all of the forms that they required. The government agency OASAS, they required some documents and we provided everything. So we just need that one document right there to say that we informed the community of the business that we're going to open. And yeah, we shared emails to them, but I guess a letter would be even better.
Okay, that's good to know.
And it just has to say that we reached out to the community and we
informed you guys of our mission, what we plan to be doing, and that we will be coming to your community soon.
Right. And when you filed the paperwork, are you referencing 247 Water as your location? Is that the plan, or do they not require you to have a physical location?
On the application, we have no site yet, but we did tell them that we are in communications with the owner of that property. So they are, aware that we are looking in an area. However, they know that we don't have a site yet.
Okay.
So that doesn't have to be the site, but that's one site that we looked at and that it's available. There's other spaces that are available for lease, but that's one that we've been in communication with, but it doesn't have to be set on that one.
Okay, great.
It's just going to be in the zip code.
All right. Well, I've asked enough for the short term here. I'm going to open it up first to members of the committee to ask questions, and after the committee's questions, then we'll ask the members of the public who are here if they have any questions, and we'll work to do that. Just a reminder, particularly to members of the public, if you have any questions, all questions need to be asked to the chair, and we'll be more than happy to put the questions forward to the presenters. First from the committee, Ms. Nadu.
Thank you. Thank you so much, Unincarcerate America, for your time and your presentation. And just, well, I think most importantly, just your interest in trying to help in the community. So I do have a few questions for you. So one, you're referring to it as a nonprofit, but then you keep referencing owners.
So we say that just because we're not sure how familiar people are with corporate structures. So we just say owners.
So
So
I,
we're the board members on the incorporation papers.
okay, I just,
So
it's-
there's technically no owners. but-
so I understand. So yes, that makes
Yeah.
sense. I would caution you, I think, on just referring to a nonprofit and also and the owner, just because that it can be confusing about private versus public. But so as you started this endeavor, because I've heard goals around, it sounds like just taking care of people post justice involvement. And so I heard nutrition, education classes, all amazing things. I will say it feels like you're trying to solve a lot of problems and a lot of challenges. Did you think before starting a new organization, were there organizations out there that you felt like weren't meeting the needs, that couldn't be built onto? I'm trying to understand, I think, what.
Okay, you trying to understand like why we building a one-stop shop? And kind of having so many different components?
Why the one-stop shop, and do you truly feel like you're positioned and set up to be able to do all of the things you named? And it's not me questioning.
No,
you know,
no, I
I'm
understand.
just trying to
After
understand.
completing our assessment of need and interviewing people who have had substance abuse issues, we realized that people go to outpatient programs, inpatient programs, and then they get cleaned and then they get released. People need tools in order to better themselves. They need to go back to school, education. If they just get clean and don't have anything to look forward to or any new skills, it kind of makes it hard to keep the process going. So we're just here to create what's the word? To create upstanding citizens and help the process become easier.
Create
So-
opportunities, maybe, right? Create better
Yeah.
opportunities.
Sorry, if we
Sorry.
could just
Yeah.
jump in for a second here. Yeah, Ms. Nadu has asked a question. The applicants have some answers. We're taking committee questions at this time. It'd be great if we can get the rest of the response to that. I'm sorry, folks, if you want to finish your answer.
Yeah, sure.
So I want to dive in a little bit. So there are outpatient services out there, but they're not providing what we providing. So like there's a million pizza shops on one block, but everybody's recipe is not the same. So it's kind of like that. Like we're doing a service that's already invented. There's nothing new under the sun. But the way that we plan to do it and measure the results that's what makes the difference, and the passion behind it. So that's the difference, our recipe and how we go about the results.
So what specifically about how you measure your results is different than what are other people not doing and how they measure their results that you're specifically improving on?
So everybody doesn't offer the services that we offer, like most of these nonprofits out here.
Sorry, just to, because I recognize I'm taking up a lot of time, just to be crystal clear on my question, you specifically said the measurement is different. So what about the measurement that you're doing? Is there, because that was also going to be one of my questions, is how are you tracking and measuring success? So I just wanted to.
Okay, so how we track and measure success is when a client comes in, they'll fill out an intake form. And intake form will have different questions like their current credit score, their current education level, their employment status. Do they have health insurance? Are they currently using any substances? How often do they use the substances? What substance are they using? So by the end of working with us, we'll be able to measure the before and after of their intake form and other information. So like if somebody comes in with a job, without a job, they'll have a job. If somebody, you get what I'm saying?
Yeah,
So
totally understood. It just, but that I would assume that all the agencies that are already doing this already do pre and, well, that's problematic. Okay.
Yeah.
Okay, I'm surprised to hear that other agencies who are focused on drug recidivism don't measure pre and post like that.
And most agencies that provide drug treatment service, they don't offer entrepreneurship courses or help with the credit or employment. They just focus on substance abuse. They don't offer that. So if somebody comes to our facility, they could get help with more than one thing.
Right.
So just to add to what Malachi is saying, I'm pretty sure that they measured it before and after as we will do, but we would just take it a step further and making sure that they not only get clean, stay clean by having a new job or having new housing or being enrolled into school in the aftercare of the process.
Right.
So continue in the process after.
Okay, thank you. Sorry, I'll stop asking questions.
No, thank you for your question, Ms. Anadu. Ms. Thurston.
Thanks. I have 3 brief but related questions. The first is, what size grant are you seeking? The second is related to your clientele. How are you planning to find folks that will use this service, and particularly in the Dumbo area? I'm curious how you'll find your clientele, and what volume of clientele are you anticipating? Like how many folks a week, a month, whatever the metric is that you're sort of seeking to measure your own efficacy.
So right now we're self-funded. We didn't request any grants at the moment. What was the second question?
What we did from OASAS.
What was the second question?
From OASAS, right? Isn't that?
No, we requested an operating certificate from OASAS.
Oh, okay. So you don't have any request for funding to them?
We didn't submit any funding.
Oh, okay. My question was how you are, how are you identifying clientele? Like how are you finding folks, doing outreach? Who is that outreach to, that sort of thing? And then relatedly, what's the volume of folks coming in to utilize your services that you're aiming for? Like to be viable, how many patients and others do you need to provide services to on a weekly, monthly basis, whatever the right cadence is?
So we get clients from different sources. Some people are referred to us. We plan to get clients from probation offices, parole offices, courts. That's like how it works. Like if somebody gets like in trouble, they'll refer them to a drug outpatient program. So, and we're also market like any other company.
Also too.
And by being in the neighborhood and speaking to people. We already have like 50 people. We are annually about 300 people.
No.
But right now, we just started for the first year.
Another way we will build clientele is that we are familiar with a lot of people in our community who have these problems, who know people who have these problems. We speak about our nonprofit all the time. A lot of people are eager to use our services. So that is one way that we will build clientele. As Malachi said before, my father did do a lot of time. A lot of people who are in facilities have prior substance abuse issues. So he will reach out to some people he know. I'll reach out to the people that I know. We have a lot of people who are asking, when are we opening up these services? People want to change their lives and they want to better themselves. And they see how we came from this community and how we uplifted ourselves. So they want to be a part of whatever we're creating.
Yeah, so we'll have people who go to the community and advocate and inform people of our services by having booths, going to different events, things like that.
Also, too, it's not set in stone. There will be in Dumbo, just in the Brooklyn Community 2 district. So right now, that's the property that we were looking at. That doesn't mean it will be there. It might be closer to what was it? What was the other part we were looking at?
Fulton.
Fulton.
Okay, I know where.
No, because I'm still
I,
street,
I-
so
I'm
it might
just
be
gonna,
closer to Fulton Street.
I'm just gonna, maybe, Ms. Thurston, do you feel like there are other questions that you need an answer to here?
I think I have enough information.
Okay, thanks. I will just offer a comment, and that is, at least in my experience, I know it's been a few years since the committee's seen much of these applications. The applicants have come to us with at least an address of where they're located. And it makes it a little bit easier to understand the community impact, in my opinion. Ms. McKnight, did you have a question?
I just needed a clarification. So it sounds like it's going to be a community-based organization. And I commend you for the services that you're trying to provide. I'm just trying to figure out, are you going to be providing any of these services on site, or are you partnering with people? Because you mentioned therapy and educational services. So are any of those things going to be on site, or are you just more of an intake facility, and then you send people out to other locations to get the services?
So we will have predominantly all of the services on site. If there's something that, or rather if our classes, or if we're too full, we have too many patients, then we will refer somebody who's trying to come to our program to a different outpatient program, or if they want to look for employment or maybe enroll into our GED program and we don't have enough space, then we will refer them to another program. But for the most part, everything will be on site. We'll have teachers, licensed social workers, psychiatrists, medical directors, everything will be on site.
Okay, thank you.
No problem.
Mr. Varela?
I apologize, it's a bit loud, so I'll ask quickly. Thank you for your presentation. I echo everyone's sentiments that this is very important work. Oh, that's loud, sorry.
It's not as
What
loud
is-
as us to it as it is to you. So we can.
Okay, thank you. I guess I'm curious about the issue of funding. You said it would be self-funded. I apologize if I missed when you explained. Where's the majority of that funding coming from? And then the other thing is, what community partners do you envision having?
So I think when Malachi was answering that question, I think he thought she was talking about right now. So currently we use our own funding to do any marketing, anything that we need to do. However, OASAS will grant us funding to run the service because it is an opioid epidemic. So they are looking for these programs. This is a need. So OASAS will give us the funding to run the program. And another thing is once we get approved for OASAS, then we have our Medicaid application and other things in the works that we will receive grants and funding from, but this is the first step in receiving those grants.
Okay,
And
thank
the
you.
community partners?
Oh, go ahead, yeah.
We've reached out to Fortune Society. They said that they love what we're doing and that if we need like a parent company or any assistance or just have any questions, that they are more than willing to help us in the process.
So we'll be partnering with local schools that provide vocational training, court systems, parole offices, things of that nature.
Great. I don't see any other committee members' hands up, so I'm going to ask members of the public or other people here in the meeting if they have a question. I would just ask if you're a member of the public, if you can limit your question or comment to 2 minutes, that would greatly be appreciated.
Hi, my name is Christina Sparrow, and I am so happy that you're bringing this to CB2. I'm a community member, and I live with mental health concerns, but I also support and have pilot to support people with substance use, misuse, mental health, justice involved, and unhoused individuals. I do have relationships with Osborne and Fortune Society as well. And one recommendation to your program is to also have people with lived experience as part of the advisory committee if you ever develop one.
Absolutely.
Yeah, because you need the lived experience of voices to help guide your program. And the outpatient program, which I like, is because people need continuing care. They come out of the system, they need continuing care to be productive and successful in society. I do support that. Let me see. Also, another suggestion is like do more outreach in the community. Go to all the health fairs you can find in the community so people will know who you are and put you on the map. The sad thing about it is a lot of times I know people are concerned about, is your program better than other people, or has other people been doing the same work? It's really sad that a lot of health professionals do not do their jobs properly. And a lot of times people will mistrust the healthcare system and don't get the help that they need. So I'm hearing your passion and I support it. And I know I'm going and I'm finishing. I work with the OMH, with the multidisciplinary, multicultural, whatever the name is, right? But I do have access to proposals. If you put a mental health component to it, I could probably send you those proposals so you can RFPs or whatever, and you could probably send them in. So I could put my email in the chat. And
Thank you so much. We appreciate the kind
If I
words.
could just interject for a second, I'm just going to remind everybody that, particularly if you're a member of the public, if you could please address the chair when you're making a comment, because it's not even if positive, whatever, negative, whatever, we just want to have everybody go back and not avoid a back and forth. But appreciate throwing your comments. If you want to put something in the chat, feel free to do that.
Thank you, Chair.
No,
Thank you.
Thank you. Did you all want to respond to the community member question there?
We just want to say thank you. We appreciate it.
Great.
I didn't really hear any questions, and correct me if I'm wrong. I just heard like the feedback, and we should go to the fairs and have peer advocates, which we will, because if it helps keep the other people in the program strong and see that if they can do it, they themselves can do it as well. So we will definitely incorporate that. And thank you for the feedback so much. Thank you for everyone's feedback.
Okay. Were there any
Mr.
other
Smith?
committee member questions on this? I understand. Ms. Muller, did you want to say something?
No, I was just noting that Ms. Richardson had a question.
Oh, okay. Let's see. Miss Richardson. Nice to see you again.
Hi. Good evening. I was on your site earlier today when I seen the agenda for the community board. It was nowhere on the site for me to get information for the resources. It just listed all the items and the services that you're providing.
Okay.
And also as a community engagement curator in CB2 in the area, I'll be happy to work with you guys. I'm gonna tag in my information because I'm currently planning a mental health and health event.
Oh,
Okay,
great.
thank you.
Mhm.
We appreciate the invite.
Mhm.
All right.
In regards to
Listen-
resources,
If we can just move on just 1 second, I'm going to go to Ms. Anadu. Ms. Anadu, did you have a question?
Just one last question. Sorry. I'm honest, and I actually said to Tay, I would love to work with, I love mentoring businesses, have an MBA, all those things. What on your site, it says that you're currently helping 74 people. So I guess I'm confused about the state of so what are you doing with the 74 people that you're currently helping?
So we work.
Where are they?
So we volunteer at another nonprofit, which is called University of the Streets. So we volunteer at that nonprofit, and at that nonprofit, I've done entrepreneurship courses, which is called Boys to Businessmen. And I teach the guys about how to go start a business, about real estate, different business aspects. So at that nonprofit, I've helped personally over 74 guys. This site was built like 2 years ago, and we hadn't updated it. We've been like focusing on getting the real stuff done besides just the website.
also too, that number comes from the people who we actually help. Like I said, my father, a lot of Malachi's friends, a lot of people from our community. So we have included that number in the people who we have helped stay clean, get jobs, enroll back into school, find housing. So it's like, though we don't have brick and mortar, we still practice it.
Yeah, I have a company that I hired over 50 men.
Okay, so thank you. So I encourage you just to make sure your numbers make sense, because even in that answer you
Yeah.
just gave, Malachi said he had personally helped 74 through another organization. Now the math is that it's coming from this and that, but on your site, it says that Unincarcerated America, it's saying that your current organization is helping these people. So I just think in terms of, particularly for nonprofits, particularly when they're trying to do community work, you just want everything to be like no one should be able to poke holes or find potential.
So as
But,
an
like,
owner, as one of the board members, I could use that number because my company hired over 50 men. And I worked at University of the Streets and taught classes with over 74 men. This website was just built 2 years ago. It's just a website. Like,
I'm not questioning the work you did. I'm just saying that your site says that the Unincarcerated America specifically has done.
so
this.
I'm a representative of
Well, it's not-
Unincarcerated America.
Yes, and
Okay.
it's not just Malachi, it's everybody as a whole who have helped do different things that I was saying, we don't have a brick and mortar, but we do help people daily, even yeah, relatives, friends. So that's where that number came from.
Thank you so much.
You're welcome.
All right. Oh, Ms. Thurston.
I'm sorry, Brandon, I have a very quick question. Are you a registered 501c3? Because I've looked and I can't confirm that. And
We are, and we can send you our incorporation documents.
Yeah.
thank you.
You're welcome.
Great. I see no more questions. So I will ask if anyone from the committee would like to make a motion. And just because we make a motion, it doesn't mean this is definitely what we're going to do. But I'll tell you what does apply. At this point, we have and wait a minute. I see Miss Einhorn has her hand up, and Miss Einhorn, I didn't formally introduce you for the meeting, so feel free to introduce yourself. And did you have a question you wanted to raise?
I did just have a quick question, and I apologize. I did come late, and I apologize to everyone. But I was wondering if they could put their link if they have a GuideStar profile, which is like the 501c3 website that they might have like a profile and some info and reviews on.
I think they said they were in the process of applying for that, but is that what you all had indicated?
So we haven't registered with them yet. We started the company 2 years ago. And since we started the company, we've been building out the policies, the procedures, and applying for the operating certificate. That's what most of our time goes to. And we plan to register with Better Business Bureau and Charity Navigator.
Okay.
And we could register with that one also.
Okay. Mr. Ryan, did you have a question? You're on mute, Mr. Ryan.
Good evening, and thank you for your presentation. I'm a bit confused because you go back and forth using terminology nonprofit, and then you also use the terminology of operating a business. Is it a nonprofit, or is it going to be a profit-making social service organization?
It's a nonprofit corporation.
But we use the term business because when we're talking to OASAS specifically, and maybe that's why we use these terms, and maybe that's why we said, oh, this is who this person is in the company, because that's what they want to know, the structure of the company. Once more moment, even though we let them know that it's a nonprofit. So we speak in these terms so that it's clear to people who might not understand what a nonprofit is. So when we say it will run as, this is how the business will run, we're referring to the nonprofit, but just to give you an overview of how it will run.
So yeah, we're just using terms that everyone can understand because we're not sure, like, if the community is familiar with these specific terms. So that was why we use these terms, but we're a registered nonprofit.
Okay, thank you very much for confirming that. I appreciate it. So that's the answer. And at this point, we can take a motion from the committee. Now, just for everyone's reminders, because I know we haven't had one of these applications in a while. There are three different actions that we can take here. One is we can recommend a letter of board support to OASAS. That would be if we generally favor the applicant's proposal, and we could potentially include any points of concern we had in that letter. Two, we could recommend a letter of board feedback to OASAS indicating we generally disfavor the applicant's proposal. And in that circumstance, we must include any points of concern that we have. And finally, we could decide we want to take no action. And in that circumstance, we would waive any right to comment or provide local insight. So motion in favor, motion to disfavor. Does anybody want to make a motion at this time from the committee? Ms. Anadu.
I motion to disfavor.
Okay, is there a second?
Second.
Second from Ms. Thurston. At this point, we have discussion on the motion, and it is at this point, the discussion is open to committee members only. Does anybody want to launch the discussion? Ms. Anadu, go ahead.
So for people that know me, they know I'm like deeply involved in Brooklyn community. I'm fully supportive. I love seeing this kind of work. One of the organizations I work with and donate to is Recess Arts, which is a anti-recidivism program for particularly youth of color right here in, Fort Greene, Clinton Hill. And so I'm supportive of the general, what the effort and what the energy is being put to. My concern is more around like the operation of it. And it is not clear to me that that there's clearly a plan for success. Like I don't understand without initial grants how, like, what is the cost per client as they're being referred to, how are people getting paid to actually manage the facility, the idea of being able to do everything. I think it's a lot happening one place where it feels like there's just, for me, still a lot of questions. And even for the questions I did ask, I don't know that I got answers that showed even that. It just feels like there's, I think they can get there, but I would not be comfortable now giving support.
Okay, Ms. Cumberbatch.
So just in listening to everything that I've heard thus far, I applaud you for the work that you want to do. However, I don't see where the funding is going to be coming from. It's not quite clear how you're going to pay for the people that you plan on hiring. You talk about offering a multitude of services, and I think you need to pinpoint what specific services you want to provide, whether it's referring people to other services. I think you need to identify what your scope of work is going to be in terms of how you plan on working with clients. And, in terms of your work with OASAS, I'm not quite sure if you have a clear understanding of what that entails. And I think you need to look at requests for proposals so that you can get funding and get the support that you need in order to facilitate what you're trying to do for the community. I think you definitely have an idea of what you want to do. I think that, in time, in terms of identifying, and you also need to have an actual location in terms of providing the services. I know that you are currently serving a number of people, but that has to be clearly defined through your organization and not other organizations. That's kind of, needs a little bit more clarity. So I think you've gotten a lot of suggestions from people here tonight. I think you have a lot of people who are willing to work with you. I think once you sit down and get an idea of what you want to focus on first, you can think about what you want to branch out later on once you get yourself established.
Thank you, Ms. Cumberbatch. Ms. Thurston.
I won't echo what
Hello?
echo
Hello?
what others have said here, but
Hello?
I'll just say that we're actually in committee time, but then we'll come back. I just want to share that it's incredibly noble what you all are committed to, and would be, the services would be something we'd really welcome in the district. However, I'd encourage you to come back when you have a bit of a business plan to share with us, and to include in your application, including a location. Like, those sorts of logistics will really strengthen your case and make it easier for us as the community board to kind of sign a letter of support. And we'll take it under consideration, and thanks for being here.
Okay. Other committee members who wanted to have comments? All right. I'll just add my comments. I had similar comments to others on the committee, so I'm not going to make a big statement, but I will say I was concerned about the lack of a physical location, as well as the issues with the business plan and the funding, which other folks described. Hearing no other committee members' points here, I'm going to proceed with taking a vote on the motion. So, Mr. Ryan, how do you vote on the motion? This is a motion to express that we generally disfavor. And actually, before I started that off with Mr. Ryan, so forget I'm going to you, Mr. Ryan. I'm going to go back to Ms. Anadu, who raised the motion, because I want to confirm what our conditions would be if this motion is approved. Would it be a fair summary in your respect, Ms. Anadu, to say that the conditions or the observations that we made supporting our recommendation would be the lack of a clear business plan, the lack of a description of the physical location, and the lack of a clear description of funding? And maybe there's something else, but I want to make sure that we identify what those circumstances are if we're going to proceed with the motion.
Yes, to summarize, my motion to disapprove is based on there being elements that for me feel like are missing in knowing that this, particularly as a community organization, which services are needed, that this organization would be a going concern, given that there's a lack of clear plan on funding, business plan, et cetera.
Okay. I see there are some others who raised their hand. I want to make sure nothing is left out here. Ms. Einhorn, did you have something you wanted to say?
Yeah, I'm not sure if we want to add this, but maybe it's a topic for discussion. That should we add that, being a 501c is a legal designation and status, and so there was a little bit of confusion around the process through which they're going through and their current status, and some that might be worth noting.
Okay. The lack of clarity surrounding legal status.
And perhaps inconsistency in responses related to those questions.
Yeah.
To Emily, yeah.
Ms. McKnight, did you have something else you wanted to say?
Yeah, is it that we're actually disapproving? Because I'm looking at what Taya wrote in the comments, and it said letter of support, or we may document specific points of concern to submit to OASAS. So.
Oh yeah, thank you for clarifying that, Nicole.
Yeah, so which one are we doing? So it's not that it's either we're giving a letter of support or we're submitting something to document our concerns.
Well, as it was announced to us, and Ms. Mueller, please correct me if I'm wrong in this, but we have the option of writing a letter of support, which would include a general statement of favor for the applicant's proposal. But the other option would be to recommend a letter of board feedback, which would not be a letter of support, but would indicate that we generally disfavor, and in that circumstance, we must include all points of concern. Is that accurate, Ms. Mueller?
Yes, and I understand how that's confusing. So maybe in plain language, you can either tell OASAS, we have had a good discussion with this applicant, and we think they're ready to go, but maybe we have XYZ concerns. Or you can tell OASAS, we don't think these applicants are ready to go for these XYZ reasons. Does that help?
Right.
Okay.
And that's the process that we've just been going through, is defining the XYZ reasons as the motion was made to indicate that we don't support. All right. So to summarize, then we've got in
Want me to
terms
read
of,
it?
sorry, Ms. Thurston.
Want me to just
missed-
read it?
Yeah, sure. Read what you have.
I adjusted the motion, which is why I offer that. So Emily, you can change, tell me changes if you'd like. Motion to disfavor the application through a letter of board feedback to OASAS, which requires identifying points of concern. Seconded. Observations made. Lack of a clear business plan, lack of a description of the physical location, and the lack of a clear description of funding. The lack of clear legal status and registration as a nonprofit raised concerns as well. That's what I've written.
Okay. Ms. Sanadu, does that sound acceptable to you in terms of the reasons?
Yes.
Okay. All right. At this point, I'm going to proceed with the committee vote. And I'm not going to go in the same. Oh, Mr. Ryan is actually first. Although before I go to the vote, Mr. Ryan, did you want to vote or did you want to have a comment? I see you have your hand up. And you're on mute, Mr. Ryan.
Can you hear me?
Yes.
No, I was prepared to vote.
Okay.
And I agree with the description to
Okay.
disfavor.
Okay, great.
I agree as well, Mr. Chair.
All right, Mr. Andrews, thank you for joining the meeting. You're a member of the board and the committee, and we're honored to have you. We've recorded your vote. Ms. Thurston,
In favor.
Ms. Anadu,
In favor.
Ms. Cumberbatch,
In favor.
Ms. McKnight.
No. Not in
Ms.
favor.
Okay, Mr. Varela,
Abstain.
all right. And all the squares moved around, so I don't know if I got everyone.
This is Lindsay Einhorn. I'm going to abstain as well.
Okay. All right, so we've got 2 abstentions, 1 not in favor, and 1, 2, 3, 4 in favor. By my count,
5 in favor.
okay, 5 in favor, yes, I vote in favor. I want to be clear about that.
6.
So is that 5 in favor?
That's 6. You're 6.
Okay, 6 in favor, 1 opposed and 2 abstentions. Great. Okay, the motion carries. So that's the decision of the committee. I think if I could say anything to the applicants, I would say we really are grateful for your presentation, and we definitely share the same goals and would love to have the services that you're speaking about in our community. But you probably heard the committee's discussion and our reasoning for our decision. And note, if you ever come back to our committee and you address the concerns that we have, we'll be receptive to hearing from you again. But good luck and thank you very much.
Hello, can we speak? Can we say some final words?
Sure, if you want to say something briefly, then feel free to
Yeah.
do that. But I want to just, we do have to move on for the rest of the meeting. So
Okay.
if you can just take a minute or so, that would be great.
So first off, we received one email from the community district and it had a list of 5 questions. It said we will have 10 minutes to talk. So with this 10 minutes, we wanted to give a brief overview of what we plan to provide.
Awesome.
Number 2, we are a legal nonprofit. This is our tax exempt letter from the IRS. This is our incorporation documents right here. And OASAS, the government agency that oversees these services providers, we provided them with our bank statements,
With over 40,000.
with our business plan, with a detailed description of over 500 pages of information. We were told we only had 10 minutes to talk. In the 10 minutes, we listed the services that we plan to provide, our experience, and said multiple times that we are 501c3. I'm not sure if you guys can see that.
And
This is the corporate documents right here from the IRS. So look at this right here.
One second. And to point out your last two comments regarding the site, OASAS said we do not have to have a site right now because we're still in the process. So it's no point of having and paying for a site. Secondly, I don't know if we were clear, but we asked OASAS for 3 to 4 million, and that would fund 14 staff members. This is all in our business plan. We could have, if we would have knew, we would have emailed it to you guys so you could have looked over it. I thought that we were just going to say, hey, this is who we are. This is what we're, bringing to your community. I didn't know, we didn't know that we had to go so in depth. We just had to answer the 5 questions. So OASAS signed off on it. And they just said basically, hey, come and welcome yourself to this community. We didn't know it was going to be like a business type of ordeal. We thought it was just like a meet and greet and kind of getting to know us. If we knew that, then we would have had more numbers. So the money that OASAS will give us, and again, the Medicaid, that will pay for the staffing. The money from OASAS will not only pay for the 14 psychiatrists, licensed social workers, peer advocates, the programs, it will also pay for community outreach things that we do. So we are well qualified. This is why OASAS signed off on our 1A. We had a meeting with the regional office with, I think it was like 3 or 4 members. They approved us and we didn't know that we were going to be.
Yeah, they literally told us we had 10 minutes to talk. We thought we were just talking to the public. We didn't know if these were business experts that we'll be talking to. And this is our tax exempt certificate. We were signed off by the regional office. And like she said, they said we don't need to have a physical space. That's like opening up a liquor store without a liquor license. You're just going to be paying rent without being able to provide service. So there's no point of having a physical location until we can provide service.
And they are okay with that. And we didn't know that we had to have an exact location. They said what?
And we provided OASAS our business plan with in-depth information on how we plan.
Mr. Smith, I recommend we move forward.
Yeah, I think we're going to do that. I thank you very much for your statements. The committee's made a decision. We wish you the best of luck. As I mentioned a few times, we would love to see you again at some point if circumstances change. Next up on our agenda tonight, we have, let me take a look. Ms. Muller, can you clarify, we have the chairperson's report, but the public notice has 3 license renewals. Are the license renewals up next, or the chairperson's report is up next?
Renewals are no longer being handled in committee.
Oh, interesting. Well, it's the first I'm learning of that.
I can also actually share a related piece of news, which is that that was discussed at the executive committee meeting.
Yeah, it was discussed at the executive committee meeting that we would have a separate meeting about that.
The related piece of news is that per the state liquor authority's change of rules last summer, we are now accepting municipal forms by email, which is going to significantly shorten the length of time and the administrative hoops that applicants have to go through to renew or to get a new license. It will benefit everyone.
Okay. So that means the next item on our agenda is the chairperson's report. My report is we've had a few different circumstances that have come up in the recent past, specifically the New Beginnings homeless shelter, where we have our quarterly we have our quarterly meetings about their status on the Community Advisory Board, met just this past week. And we got an update that so far this quarter, there have been no issues raised by neighbors or concerns that have been brought to their attention. There were only 2 residents who attended this meeting, which was interesting, but there may be some issues about the extent to which everyone is informed. So I think that the DHS is going to look into making sure that the meeting notices are distributed, and we definitely heard some good feedback. They are changing program directors there, but it seems like the new program director they're getting is a person who is a little bit more experienced even than the one that they've already had, who's been pretty successful. The other, I guess, notable thing to say is that they remain almost fully full with beds at the location. And they also indicated they had a success story of having reunited a homeless person who had no home or known family with their family, and they're getting placed in an apartment this week, which is a really great story. They have a number of other people who they've been able to successfully provide services to, and nobody had any concerns that they expressed at the meeting. There was a question about there was some police who showed up at the location, but it was not able to be documented by DHS. So, and there wasn't a whole lot that could be shared about it. So it sounds like it wasn't a major incident. But that was basically the nature of that meeting, which was on Monday of this week. Next, on the health fair, we are delighted to report that we have a approved permit from the Parks Department, which we will continue to, which we will be excited to use for our event, which again is June 10th at Commodore Barry Park, 11 a.m. to 4 p.m. I also want to note about that there has been a subcommittee successfully established, and we have met once, and we're meeting again tomorrow, 6 p.m. And I encourage anybody on the committee who's interested in being part of this effort. I'm not just placing people on this, without getting people's confirmation. You do have to email me to let me know that you're interested in joining the subcommittee and being part of the planning process. I hope that, if people are interested, that there can be a desire not just to give us your great opinion, but also to do some work to help with planning the event. I would note we definitely could use some assistance with bringing the element of climate change into this health fair for anyone who's interested in doing that. There's particularly if you know vendors or people like that. So just let me know if you're interested, and you'd be encouraged to get that going. That concludes my chairperson's report for the evening. I'm going to move on to other committee business. Anyone have any other business they'd like to raise?
Oh, just one quick thing, Brandon.
Sure.
Just a reminder to folks, if you're able, the third and final Office of Cannabis Management information session, I'm simplifying my client information session, but I forgot what it's called, is tomorrow morning at 10 a.m. And while we're still not, it hasn't necessarily been determined how this committee will or will not be involved in processing those applications. I'm really looking forward to attending and encourage folks to do so. And Taya kindly shared the link earlier in the chat. I'll repost it in case anyone didn't see it in the chat as well.
All right. Great. Thank you very much. Any other matters of committee business for committee members to raise?
Alejandro here, Brandon.
Mr.
I
Varela.
may. Thank you. Just two things. One is that I emailed, I think, a series of questions that had come up last month about how to maybe address some issues around disability and senior sort of or elder living as it concerns navigating restaurants and other stuff. Just ways to kind of plug in some senior friendly. I think I was told last month we're not using the word senior anymore, but I can't remember if that was here or in another meeting. But so I sent that list of questions around. It's really a rehashing of questions that we've been bandying about for a few years on the board now. That's number one. If folks haven't had a chance to look at it, if you could please look at it, and maybe we can talk about it next meeting or over email is fine. And number two is I wonder if we could have a very quick debrief about the application that was just presented and how that went down. I don't feel great about how it all happened. I don't have a particular complaint, but I feel like they really did show up with a very different understanding of how things were going to go. And I don't think we were necessarily wrong in voting against it, but I'm just curious as to how they showed up with such a different understanding of what was actually happening here. And also want to clarify that in the end, they were showing us paperwork that they were a 501c3, but Jessica, you had put in the chat that you had found that they weren't. And I'm wondering if there's clarity around that, because that's a pretty big discrepancy. Because that clouded for me, when I saw that, I thought, okay, the wool's being pulled over our eyes or something.
Okay. Yeah, thanks for raising your comments, Mr. Varela. And I, as a matter of other business, if anybody has any other comments to raise about it, I'd be happy to hear from them. Ms. Anadu, did you want to make your own point, or did you want to respond to Mr. Varela?
Respond to Mr. Varela.
Go ahead.
Alejandro, it's funny, I don't feel great about how the conversation went, because I think it felt, or I could see how it could feel like it was a lot more oppositional than it was. I think I sit in a place where I want our recommendations to mean something. And so for me, it didn't feel like the questions that were being asked were necessarily unreasonable. Nor do I think that if someone had told them there are people at the meeting who do business, I don't know that I would have been looking, because no one would have asked them to go through like EBITDAs. We weren't asking to look at balance sheets, but it felt like even very basic questions to me that weren't about deep business issues were not being able to be answered. So like, for example, if I ask, why haven't you worked with others? How is what you're going to do going to be different? And then if the response I hear is measurement, but then the next, for me, it wasn't, I don't know that if they had been told, people might have different questions, but I just think that if you're in a place where you're literally running and operating a business, you should be able to answer what, again, to me felt like very basic questions. And again, I don't like how the conversation turned out, because I feel like it became antagonistic. And I think even the tone that was being used and showing us materials at the end, it didn't feel good. But again, I don't know that the questions we were being asked, we weren't asking interns. We were asking people who clearly are at the forefront of this organization, and according to their website, have been working on it since 2006. So that's just my thoughts on that.
All right. Thanks, Ms. Anadu. Mr. Ryan.
There were a lot of flags that went off for me prior to working with, I used to work for a nonprofit agency in the East New York section of Brooklyn. It was an alternative school, and it was funded by OASAS, the Board of Education, and private funding. There were a lot of alarms that went on for me, and I was uncomfortable because, I think that there is a need. And I don't believe, based on the conversation that I heard, that they had a real understanding of OASAS, how the funding process goes. I was really concerned when they, because you can run a profit-making substance abuse program, and there have been profit-making substance abuse programs. It wasn't clear to me whether they were nonprofit, even though they stated that this is a nonprofit endeavor. It's using the terminology that they used. I was extremely uncomfortable because you can open up a nonprofit agency like that and make a profit. Deficit funding. They just did not have their presentation together. I was alarmed. I worked in the East New York section of Brooklyn, grew up in Crown Heights, Bed-Stuy. I wanted to know what was different from between Phoenix House, Daytop Village, programs that are being funded by Kings County Hospital, Brooklyn Hospital, Brookdale Hospital. Their programs like they were describing already exist in Brooklyn. And then, we've had issues with heroin, my God, even in the 1950s in Brooklyn, Harlem, the Bronx. This is nothing new. I just didn't see any where they stood out and where the service that they wanted to provide in this particular case and truly not having all the information, what was the difference at all? I didn't know how to sit on my hands. I'm glad that we're having this conversation now, because for me, there were a lot of alarm bells that went off.
Okay.
Okay.
Thank you, Mr. Ryan. Any other further comments for Mr. Varela's other business topic?
The only thing that I would add, I understand where Alejandro is coming from. This organization is a grassroots organization, and a lot of times people might have the expectation that they show up with a level of expertise that they may not have gained yet. And that is what happens a lot, and they might need some help in getting off the ground and running. But the expectation that they show up with the same level of expertise as another not-for-profit that has been around longer, knows how to write grants, I think it's a little unfair. Do they need help? Yes, but sometimes we have to come with a different level of understanding that people who are able to serve the population, who are going to trust them and come to them for services, aren't going to always show up with the level of expertise that we may be looking for. And that's all I have.
Thank you, Ms. McKnight. Any other comments on Mr. Varela's other business item?
Brandon, if I may, I want to clarify that I appreciate everyone's comment. For me, I guess I want to not make sure, we can't always avoid sticky or uncomfortable conversations. That's impossible. It's just, if there was a going forward, is there something we could communicate to the applicants, or a way to just decrease the likelihood of these uncomfortable or difficult conversations, or just where someone is completely off base with expectations, and we're the first time they're seeing it.
I would just say to you in that regard, Mr. Varela, we each come here from a community board perspective with our different viewpoints on things, and different people, sometimes we have votes where we're unanimous, sometimes we have votes where we have different points of view. But on this particular vote, we have specific things that we were allowed to communicate to the applicant. We could write a letter of support. We could write a letter of feedback with indicating that we did not support. And while we each had our points of view, which is individually valid about this, the majority of this committee voted to send the letter of feedback with our list of concerns. And beyond sending that and expressing our I think clear consensus of support, I would wonder, what else would you want us to say about to the applicants about the approach of the committee, given that we voted on a matter that indicates our feedback, and are not just on the one hand saying that we don't support, but also we're receptive to them coming back, and we generally support the concepts. But I guess
I hear you, Brandon. As always, I think you're being very thoughtful, and I appreciate that. And I mean that. I guess it was as simple as like I was building my own sort of mental case on where I was going to go, and I took as two very big points the fact that they didn't have a location, and we listed that as, you don't have this location, and then you're not actually a 501c3. And then we took the vote, and then they came back with information that I didn't have before, that I didn't know. That's on me, right? Not understanding OASA and the process, but suddenly they were very clear that OASA said, you don't need to have a location, that's not urgent. So if we're sort of building internally, there were lots of red flags. I agree. So that's not the only case. I'm just saying, you see, those are sorts of bits of information that I didn't know, that maybe we should know if we're going to be listening to applications where the agency is OASA.
Right. Well, I think we can all interpret those statements and those different pieces of information our own way. And, I appreciate your point of view on that, just like I appreciate everybody else on the committee's point of view on that too. Mr. Ryan, did you have something you wanted to add?
Yes, just in closing, I think it's fair to say that with the level of funding that they would be looking for from OASAS this evening, their presentation was not up to snuff, even on a very basic level. They came in and they were not prepared and did not expect the level of questioning that was put forth. And this is just on a very basic level. They were not prepared this evening. And, I really don't know what they were expecting, but right. They were who, my personal thoughts is that, whoever their board of directors threw them to the wolves this evening. Thank you. That's all I have to say.
Thank you, Mr. Ryan. Okay. Any other committee members have a comment for the discussion item that Mr. Varela raised? All right, hearing none, I'm going to move to the next item on the agenda, which is community forum. At this stage, any members of the public who are in attendance have 2 minutes to express their opinions on any topics that they'd like to bring to our attention. Our friends at Unincarcerate America seem to be with us still, and I will give them 2 minutes to express their opinions. So I don't know if what would you like to raise? I imagine it's up to you. So if you'd like to take the floor, you got 2 minutes. I don't know if you're planning to speak, but if not, I can move ahead. But
oh, sorry,
you're talking to us?
We didn't know you were giving us the floor right now.
So
yes,
thank you. I'm glad the guy raised that point, that you guys didn't know the details of the OASAS requirements. You are not required to have a physical location on the application, and we are an incorporated 501c3. And we only received about 2 emails from the board, and it just said, provide us with a logo and a brief description and a website. We provided that. And I'm glad the other member said that you're expecting us, a startup company, to have the same amount of experience as a business that's been in business for over 200 years, 100 years, 50 years. And we are privately funded. We provide OASAS with our bank statements that show we can cover the operation for 6 months. So I think that's unfair that you could say that, oh, it's not a 501c3, but we have the IRS documents right here. And on the OASAS application, it says you don't have to have a physical location until you get your operating certificate. Why would we pay for a space without being able to operate?
And let me.
We have places in mind. So I don't think that's fair. So thank you for your time. And we just wanted to say that part. Like,
1 second, I want to put up a picture of all of the places.
and they said we're only gonna have 10 minutes to talk. Keep it brief. And in the PowerPoint, if you guys want to go back to it, it has all of the details of the services and what we plan to provide. Because one member said that it wasn't clear what services we plan to provide, but it's right there on the PowerPoint.
Also, when we did our need for assessment, we did our research, and in Brooklyn, it's only 22 substance abuse outpatient programs that provide opioid services. So, and with those, they only provide, I'm like a little bit flustered, opioid services. With ours, the reason why OASAS loved it so much is because it's a one-stop shop. They understand that, yeah, you can go to a program and get clean, but what's next? If you don't have good credit, how can you get an apartment? If you don't have a job or education, how can you continue to thrive in life? Yeah, you might.
You're over 2 minutes at this point,
sorry.
so I'm gonna have to stop you there. But well, I appreciate your comment. I'm gonna go on to the next. Person in community forum, Ms. Sparak.
Thank you, Mr. Chair.
Got 2 minutes.
Thank you, Mr. Chair. So I wish this whole thing started on a better note. You know, I'm sorry for this whole experience, but I'm just learning. I have no power here. I'm just learning about this. So when I started my PCIT project in Brooklyn, Person-Centered Intervention Training Project, I brought in all consultants. So I didn't have my own space. I brought in all consultants, but I was able to get a lot of funding because the funders believed in my vision. And I also believe in a one-stop shop because it's like, I believe in the social determinants of health. If a person doesn't have employment, they can't get a job, or they can't get housing. If they don't have housing, they can't get to work. If they don't have this and that, they can't have access to their families. So I understand there's maybe some red flags, but I'm all for grassroots organizations. I was a grassroots organization and I have funders believe in them. And I know I have no power or decision-making power, but that's just my 2 cents. And I hope that was 2 minutes. Thank you.
That was definitely within 2 minutes and definitely with room to spare. Thank you, Ms. Sparak. All right. Any other community members that want to raise a point of discussion in community forum?
Where am I?
Sorry, I'm not. And maybe my squares are not working properly. Who's talking? Miss Richardson, did you want to speak?
I don't know what's going on here.
Yeah.
Hi. I just want to say great job, guys. E for effort and don't give up. I wanted to discuss oh my gosh, there's so many things. So I wanted to know, was CB2 going to be involved in the 50 years of hip hop?
I don't have any information about that. Miss Muller, do you know anything about the 50 years of hip hop?
That would be so much fun, Tanya, but nobody invited us to the party.
It has nothing to do really with the HESS committee, but it is a big thing in New York City. And being that you're going to have the event in June 10th, I'm like, perhaps I can try to get some performers in the park.
May I just
Perhaps this is something you can discuss with the with the district office,
subcommittee?
if you have a point to raise offline.
Okay.
Ms. Richardson, are you offering for the health fair?
Yeah,
No.
yeah.
Ah,
Can I answer, Tanya, just about the borough and the city and the history of hip hop? Because I do have a brief answer for her just on that, because I have.
well, we're in community forum, so. if
Oh,
you-
sorry.
you
I was
have
just gonna
two-
answer
well,
quick.
you,
I'll type you a note in the comments, Tanya, in the chat.
Thank you.
or you could have an additional 2 minutes, Ms. Nadu. I'm happy to give
Oh.
that to you, but
If I'm understanding, I think Tanya is offering to secure some performers for the health fair on June 10th. Is that correct?
That is correct.
All right.
okay, let's talk about that. Let's talk about that in the, I've got your information, Ms. Richardson. I can reach out to you. We can talk about the health fair. We have a separate group for that, and I'm happy to hear your thoughts about it. We have a number, we have a park permit, so there are some guidelines that we have to work with the park, but I'm always interested to hear people's ideas about things, so I'll be interested to hear yours. All right, anyone else for community forum? Not spoken already in community forum.
Mr.
right.
Chair, I'm sorry, I'd like to help with the health fair as well.
Oh,
Christine,
Ms. Spirik, wonderful. That's nice to know. I'll if you could email the board office, then that would be great. And we'll try to figure out how we can best work, and maybe just indicate what you're specifically interested in the email.
okay.
Thanks. Anyone else have a comment for community forum? All right. Motion to adjourn. Anybody want to make a motion to adjourn?
Me, Alejandro, me.
Mr. Morella raises a motion to adjourn. Any second?
I second it.
Second from Ms. McKnight. Anybody oppose or abstain the adjourning of the committee? It looks like nobody. Thank you very much, everybody, for a great meeting. And I hope you all have a good rest of the evening.
Thank you.
Please look at your email.